Good evening, everyone, and welcome to those who've been with us since Monday. Welcome back, and to those joining us for the first time tonight, we're glad you're here with us. Before I get started, I forgot yesterday, but because we have Dr. Arwady here with us, I do want to show everyone that we are 6 feet apart for our viewers at home, so we are socially distanced. Today, we are going to talk about the city's human services departments and budgets. I have with me today Commissioner Allison Arwady from the Department of Public Health, Commissioner Rachel Arfa from the Mayor's Office for People with Disabilities, and First Deputy Commissioner Brandie Knazze from the Department of Family and Support Services. Thank you all for being here with me tonight. Like we do every night, we're going to start off with a quick overview of each of our department's budgets. The data and graphics for our discussion, for those who want to follow along at home, can be found at chicago.gov/budget dashboard. All right, let's start off with MOPD, who is the city's agency that promotes access, full participation, and equal opportunity for people with disabilities through education and training, advocacy, and direct services. In 2020, MOPD's budget was $7.6 million. Commissioner Arfa joined the department in July. Commissioner, as a new commissioner, can you tell us a little bit about some of your goals for the department?
Yeah, absolutely. Thanks for having me here. So I've been here since July in order to explain who MOPD is. We serve our people with disabilities, including people who have visible and invisible disabilities, and people who acquire disabilities. I have some goals for our department. First, we want to improve employment outcomes for people with disabilities. This is the 30th anniversary of the Americans with Disabilities Act, and we still have more work to do to increase employment opportunities for people with disabilities. And I am also taking a visual equity lens at all of our work, both internal department with our great team and staff, but also external, to make sure that we provide our services in every part of the city and make sure we have resources at the south, at the west side of Chicago. We do have a field office at the west side of Chicago then. We will make sure that we have these focused resources into, and then I will be working with every one of our city departments and our sister agency to set up ADA, the ISN program in every single department, so the departments have resources on how to make all of their programs and services accessible, both from a physical and a communication access perspective. Finally, we're also looking at making sure in this COVID-19 time, making sure that we can provide our services both outside, but also virtually, and how we are adapting our services to make sure that it does not matter if you're not able to come into our space physically, but then you can access that by phone or virtual means, such as using the Hotline program. So those are some of the things that we're working on.
Lots of exciting things. We're glad to have you with us. DFSS is the city's primary social service funder, supporting services to families, youth, persons experiencing homelessness, victims of domestic violence, seniors, and workforce services. DFS's budget for 2020 is $686 million, and which, as you can see on the chart, is primarily comprised of grant funds. As you can see, 90% of this budget is for non-personnel costs, and the vast majority of that goes out the door to our delegate agencies. Brandie, can you tell us a little bit more about what delegate agencies are and what types of services they provide?
Thank you, Director Parks. Yes. So at DFSS, we are the city's primary social service funder for human services within the city of Chicago. And we work with a compadre of nonprofit agencies that we refer to as delegate agencies. And so with the local, state, and federal dollars that we receive, we delegate our work to have this done in community to the nonprofits that we work with, and we contract with the delegate agencies through the request for proposal process. If you think about DFSS and the programs that we provide services that span from early learning and the early years of childhood all the way through seniors. And so we have 7 major issue areas that we fund nonprofits to work, and that includes children's services, youth, seniors, workforce, human services, domestic violence, and seniors.
Now, due to COVID-19, I know we've talked about this on Monday, the city received federal funds primarily through the CARES Act to respond to the pandemic. Both DFSS and CDPH manage a large portion of these funds. I want to note that the funds that we received through the CARES Act are one-time and specifically for our response to the coronavirus. But DFSS received approximately $126 million in additional funds to address the impacts of COVID-19, which brought their 2020 budget to more than $812 million. Brandie, can you talk a little bit about what the types of programs that DFSS is doing to support with these funds?
Definitely. So with the COVID dollars that we received through CARES funding, we used those dollars to work with our delegate agencies to support individuals who are out of work due to COVID. And so we intend to work with our workforce agencies to get people back to work. And additionally, we've used that funding to support food insecurity, working with the Greater Chicago Food Depository and supporting our home delivered meal program. We've also invested in rapid rehousing to make sure we're able to get people who are living in shelter into their own housing, as well as the Emergency Rental Assistance Fund to provide rental assistance for 3 to 6 months for individuals.
All right, and then lastly, next, let's talk about public health's budget. CDPH is the city's public health agency. I know we've heard a lot about CDPH because of our COVID-19 response, but there's actually other programs that CDPH runs, which include services to persons living with and at risk of HIV Aids, food safety and sanitation, citywide data collection and analysis of communicable diseases, funding and providing mental health services, and lead poisoning prevention. Both DFSS and CDPH also manage violence prevention programming. So CDPH's budget at the start of 2020 was $221.6 million and is also primarily comprised of grant funds. Due to COVID, CDPH also received more than $325 million in additional grant funding since then, bringing their budget to $547.6 million. Allison, can you tell us a little bit about how CDPH has been leveraging these COVID-19 funds?
Sure. So obviously, when people are thinking about public health these days, they're thinking COVID-19. Yes. The programs you mentioned are actually just a sample of the work that CDPH does all the time and that we've had to keep moving even with COVID. But obviously, this has been not only a huge challenge for us as a department, but has offered a real opportunity in terms of real funding to be able to combat COVID-19 here in Chicago. And I want you to understand that most of the programming that you're hearing about is really coming from this bucket. So for example, all of the contact tracing work that we're doing, we are going to be funding through Chicago Cook Workforce Partnership 30 community-based organizations to be doing community-based contact tracing. We're funding federally qualified health centers and hospitals, all of the city-sponsored testing. So we're spending about $2 million a week right now just supporting testing and trying to think about what that looks like in a long-term sustainable way. All of the work that needs to be done at the health department, so we need to bring on additional scientists and epidemiologists. Most of our funding comes through the CDC from a grant called Epidemiology and Laboratory Capacity. And we're required to make sure that we're building data systems that can handle the huge amounts of data that's been coming in through COVID. And if you've not checked it out, please go to chicago.gov/coronavirus to see all you would like to see about COVID-19, as well as a lot about our data. We also do a lot beyond just the testing that people see. There's behind the scenes testing to look for genetic things related to COVID virus. Even things like masks, community outreach, working with partners, education, the list goes on. It's a huge challenge, and we're always trying to think ahead. So not just what do we need to respond to COVID-19 right now, how do we make sure we're pushing resources in the city where it is most needed, but what is that going to look like in a few months where we're starting to move into a vaccination campaign. And we're trying to make our COVID investments, think about them in a long-term way. So where we can make investments in mental health, where we can make investments in some of the community-based resource coordination, in the contact tracing. Those are investments that, although they will be born from COVID, we're really trying to think of things that will grow our capacity in a long-term way in Chicago.
Thank you. Okay, there have been a lot of calls for defunding the police to increase funding for various social services. And we've had a lot of those conversations both Monday and definitely yesterday as we talked with our public safety departments. Everyone's departments already have a role in violence prevention that some people may not know about. So we'll go and talk to each of you about the different roles that you are playing in violence prevention and what new and exciting investments your departments has implemented. So we can start with you.
Okay, sounds good. Obviously, we as the Public Health Department are especially interested in preventing violence. And so we have existing programming that works in the true prevention space. So that might be with younger children, things like bullying prevention or suicide prevention or even mental health awareness that can lead, like true prevention work. We also do what we call intervention work. That could be at a school level where you're reinforcing those prevention messages, turning them into actual tools that people can use. And then we have true response mode. And that is really when violence is occurring, making sure, for example, if there's been a shooting, are the family and the people who have seen that shooting and that community, are they being connected to trauma-informed mental health services well? Really making sure that's done. What kinds of supports are coming for families and communities that are disproportionately impacted by violence? So we have specific programming there. Even before COVID, we had made some big new investments in violence prevention as a city. So more than a doubling of the CDPH's budget for violence prevention even before COVID, and then we've had additional opportunities.
Right.
So there's new $6 million that's just gone out recently to fund street intervention services, which is really working with people at the highest risk for violence. And that's been a big, important investment. Big new investments in terms of getting additional investments to move people who may be perhaps calling 911 a lot, but it's not maybe a police issue as much. So if there's calls for mental health primary reasons or substance use, overdose, this kind of work, how can we get those folks connected to the services they need and get people into treatment? So I could talk for a long time about this, but there's deflection, diversion, and programming. And perhaps if there's additional questions, I can add more.
Great. What about you, Rachel? I know there's work you're also doing around the violence prevention.
So the Chicago Police Department recently hired an ADA coordinator to ensure that police interaction services are accessible for people with disabilities. They've also hired a language access coordinator to ensure that the police department provides services in languages piece of what people need. So me and my team met with both of them. We discussed resources. We will be working with them and training and using this as an opportunity to provide training so that police officers are more disability etiquette and how to interact with someone with a disability. We hope that this reduces tension and also avoids any miscommunication or misunderstandings that may happen when interacting with our police department and a person with a disability.
And Brandie?
Thank you. And so at DFSS, as our programs begin, the contracts end, we look at best practices, research, and we assess gaps in our programming. And so this year we had a handful of programs in our youth prevention and intervention portfolio that we're going to sunset in December. And so we took this as an opportunity to retool existing dollars. And so in March, we released an RFP for coordination and navigation for youth at the highest risk of violence. And this RFP focuses on youth that are aged 14 to 24 who have been involved in either street, gang, or clique involvement, as well as justice involvement. We'll also, for the program, it'll support youth who are disconnected from school, who may show signs of trauma, or who have been victimized. And so the real difference when we looked at equity and access for the program is that the previous programs we had focused on primarily male youth. This new program that will start in January will focus on young women as well as LGBTQ plus youth and youth who are unstably housed. And so we plan to provide a more holistic approach to delivering services in January.
Okay, next question is from Karen McKibben on Facebook. Can someone tell me what the total budget for all departments in this town hall, including, So yes, the total budget for all the departments of today, which includes also their additional COVID funding that I talked about, is nearly $1.4 billion. All right, our next question is from Mary Anderson from AARP. Approximately 31% of the population of Chicago is over the age of 50. What is the plan for providing services to this population?
Thank you, Mary, for that question. The DFSS Senior Services Division is the lead area agency on aging for Chicago. And so what that means is that we provide a comprehensive portfolio of programming for seniors who are age 60 and over and their caregivers. One of the first things that we did when we realized that COVID was here in March is that we have 50 congregate dining centers that provided lunch to seniors where they could come sit down and have a meal. So beginning in March, we transitioned those locations from congregate dining to to-go box lunches. By the end of March, we had transitioned all of those centers. Anyone who was receiving a to-go box lunch, they were eligible to receive a home-delivered meal. So from March, we went from serving over 6,000 seniors for home-delivered meals to, at the height in June, over 11,000 seniors weekly. That was a really big thing that we did because we really wanted to make sure that seniors had access to food and healthy nutrition. In addition, we really wanted to make sure that with social isolation that we were able to stay in touch with seniors since that they could not come into our centers. And so we worked to do good neighbor checks, and so we developed scripts with our volunteers so that they were able to keep in touch with our seniors. Any senior who needs a well-being check, or if a family member can't get to a senior, they can call 311 and we're able to send a team out who will do an in-person visit to a senior. If that person needs more supports, we will also connected to them. We additionally have a information and assistance senior hotline, and so anyone can call Monday through Friday from 8:30 to 4:30 and be connected with our staff that will connect seniors and caregivers with needed services. And so that includes counseling services, which have been transitioned virtually. We also do gap filling for seniors and their caregivers of up to $250. So someone, if you need, let's say, an assistive aid device or you need a shower stool, we can help with those necessary supplies. Our programs also provide respite services, legal services. We have a whole portfolio. As we transition into really thinking about how we stay in touch with seniors during social isolation, we've really turned our attention to our virtual technology. And so on our Facebook page and our YouTube page, you'll see that we're starting to put up videos so that seniors can still interact with us and receive services that include health promotion and fitness, because we really want to be able to keep seniors to live in their home independently and stay active. Tomorrow at our senior centers, we're going to be opening for flu clinics from 9:30 to 11:30, and so at 19 of our senior centers, people can come out. Seniors, all they have to do is bring an insurance card. If they don't have them, that's okay, because they will still receive a free flu shot.
So MOPD also provides services to people with disabilities who are through age 59. So we have a lot of overlap between our department, which is great. And so first, if you are seeking services, you can call 311 or use the app to put up any information. There's some services that we also provide in MOPD. We provide assistive technology. So for example, if you need an amplified phone or a captured phone, MOPD can provide that. There's not an age limit for that service. And we also have a home modification program where if your part of your home is not accessible, so for example, maybe your front entrance is not accessible, a home modification program can evaluate a home and add a lift. And then we also can make a bathroom accessible too. And then we also have a homemaker service where if you need assistance in the home a few hours a week, we provide that to people with disabilities. And then we also provide employment services to people who are over 50 through age 60 through a RIPA program, which is funded by the Social Security Administration. And then we also advocate for policies that benefit this population, and including people who may acquire disabilities as they age, so we do consider that in our policies.
Okay, we have also received several questions regarding the city's services to persons experiencing homelessness. Here are a couple of them. A question from Nancy Turner. What is the city doing to support youth who are homeless? And another question we have from Ishmael Enriquez. How can you provide a decent home to homeless people? I'm going to send this question to Brandie first. Can you tell us about DFSS programs to address both youth homelessness and homelessness more broadly?
Thank you. So DFSS is the city's lead agency for ending and preventing homelessness in Chicago wherever possible. We work in collaboration with our nonprofit partners, funders, stakeholders, and city agencies. We manage an infrastructure portfolio of $30 million that we use funding to support our nonprofit delegate agencies to provide services and resources to homeless individuals in the areas of shelter, outreach, support services, rapid rehousing, and flexible housing. Now, when we think about our homeless outreach and prevention team, they work alongside our nonprofit delegate agencies, and they provide outreach during the day and at night to individuals who are living on the street. And that's been really important during COVID because we want to be able to understand where people are living, who they are, and educate them about COVID-19. And so we've really worked with them to make sure that we're doing testing in the encampments, we're making sure that we're providing the PPE, we're providing them with medical attention as well as food resources. We are really thoughtful about how we approach this work. We've been able to keep our positivity rate at our encampments to below 2%, and that's really been a good partnership that we've used with CDPH, UI Health, and Rush Hospital. The other thing that we're doing for our street outreach is per CDC guidance and CDPH recommendations, we were able to place 12 portable hand washing stations and porta potties at our largest encampments in the city to really support hygiene standards. When we look at our shelter providers, one of the things that we did from recommendations of the CDC and CDPH was we looked at decompression. And so at our footprint for our existing shelters, we literally pulled out 700 shelter beds and we stood up alternate shelter facilities. And that was really to allow for adequate social distancing to help keep people safe. In addition to that, we also support with our CARES funding, 1,250 units for rental assistance. And that's really important because one of the things we want to do is keep people from becoming homeless. The third thing is really working with our rapid rehousing dollars to make sure that we can quickly assess and identify individuals who are most vulnerable and have multiple underlying conditions and get them into rapid rehousing and out of the shelter system so that they can manage their own health care in their own homes. The last thing we did is working with CDPH was on shielding units, and so we were able to identify individuals who were 60 and over who had multiple underlying conditions and place them in over 160 hotel beds. When we transition to our youth homelessness, we have 4 drop-in centers where over 1,000 youth can come and get resources and support on a daily basis. We also support 6 youth shelters across the city, and we have funding for $5 million to support flexible housing for youth. And so that's going to translate to about 100 units of housing for youth, and we think that that will impact a 25% dent in youth homelessness across Chicago.
Can I just add one piece there?
Yes.
Just I want to say on the COVID piece, Chicago really, I think, should be very proud of the COVID response that together we've worked on for people who are experiencing homelessness. This obviously is a highly vulnerable group, especially where we think about folks who have maybe concurrent, mental illness or physical illnesses, often a lot of other issues that can go along with that. And just on this shielding housing, I just want folks to understand that what we did here, instead of waiting for folks who are experiencing homelessness to develop COVID symptoms, people who are high risk put them in hotels, and then worked to make sure that there were services for folks. So while they were in this shielding housing, and you've probably heard a lot about the quarantine and isolation housing that we've done, worked with a lot of community partners, some of our federally qualified health centers, other folks really banding together to make sure people were getting the kinds of treatments that they needed, and then worked to move folks into permanent supportive housing. And I think that's a really good example of taking kind of an investment that had to happen quickly because of COVID and thinking about how do we actually create some models that let us work on this problem in a more long-term way. So we took that with, like, we get some HIV funding for to help support housing for folks who are living with HIV, vulnerable to HIV, and this same idea, this hotel to home idea, that you can very quickly perhaps move someone who's highly vulnerable maybe into a hotel setting while you work to transition them into permanent supportive housing and protect them, is a newer model, and I think one that COVID has allowed. But a lot of cities have seen many people, unfortunately, experiencing homelessness die from COVID. And at this point, you know, we've unfortunately had about 2,700 people in Chicago die of COVID. We're only aware of 2 people who are experiencing homelessness who have been on any of these registries at this point who have died. That's still 2 people too many, but compared to what we've seen in many other places, I'm very proud of the work that we've been doing and continue to really do. It's a priority to work on this together as a city.
Thank you. Okay, next question is from Letitia Diaz. With the detrimental effects of the pandemic, how will you fund the mental health of communities that were already marginalized by the system?
Okay, I'll take that one. So, mental health, also big priority here in Chicago.
Yes.
And really before COVID, I want to make the point that when Mayor Lightfoot came in with the new budget this year, we actually had the biggest investment in mental health that we had seen. We had a doubling of our budget in mental health at CDPH. And then similarly with the COVID funding, we've been able to add additional funding there. Our goal always is to make sure that people can get access to high quality mental health care near where they live in ways that are linguistically and culturally appropriate, and get rid of barriers. We want to make sure that people can get high quality care regardless of where they live, their income, their insurance status, their immigration status. And so just to give a concrete example of this, right now we have out on the street what's called a request for proposals, an RFP. That's when the city releases an opportunity that organizations can apply for funding. $6.5 million new dollars that we'll use to fund up to 25 community-based mental health providers, specifically in the communities that are highest need. And so to this point of communities that have been marginalized, we look at the data. We see where are there not enough mental health services? Where do we see a lot of those, 911 calls or transports for mental health needs? Where do we see these other root causes that we especially need to invest? And so community mental health centers, federally qualified health centers, other providers that serve people, again, regardless of income, insurance, immigration, et cetera, will be able to get additional resources and be able to grow that capacity for treatment. We also think a lot about that prevention piece, the messaging piece. What are we doing? We'll have some new opportunities to invest in suicide prevention that we've not been able to do previously with some of the COVID funding, really trying to think. I think COVID has been hard for everybody's mental health in Chicago and across the U.S. It's offered, I hope, an opportunity to thinking about mental health without the stigma that historically it has had. Mental health, physical health, they work together. And I really want us here thinking about how we promote mental health and think about getting care to people with some of the more serious mental illnesses. We've also been able to put new funding into outreach to people with some of these more serious mental illnesses who maybe can't really keep a clinic appointment at 10 a.m. on a Tuesday, people who may be experiencing homelessness, to bring services to them, get mental health out of the clinic and out to some of the people who most need it. So big, exciting new investments. I'm thrilled about some of the ways we're going, thinking exactly about this issue. So thank you, Letitia, for the question.
And I know this is a huge priority for the mayor.
Yes.
And this was also something that last year when we were doing these town halls, we heard a lot from our residents about the importance of mental health. So that's great news. All the great work that you're doing.
Yeah, and even during COVID, mental health was, we upped our work on COVID.
Right,
a lot of people in other programs had to get pulled in, but I said our behavioral health, our mental health, our substance use, our violence prevention, keep working on that because we're going to see indirect effects from COVID, and it remains just an absolute top priority of the health department.
All right. There's been a lot of focus on the equity lens in our budget. We've had a lot of discussion both Monday and Tuesday about all the different ways as we go through the budget process of how we're really putting an equity lens on everything that we're doing, and even at the department level. So I want to take that and, talk to you about the Healthy Chicago 2025 plan, which addresses the racial inequity and the life expectancy gap. Can you tell us a little more about this plan?
Yeah, I'm happy to. So we were meant to launch our Healthy Chicago 2025 plan back in the March-April range. Obviously, with COVID, we did not launch it at that point, but I invite everybody to our virtual launch, which will be on September 17th at 2:30 p.m. So if this gets your attention, please come back to learn more. Every 5 years, the health department and the city of Chicago are required to put forward a community health improvement plan. And so we engage literally hundreds of partners across the city to think about what should our priorities be? How should we together think about improving health in Chicago? And with our last iteration that was called Healthy Chicago 2.0, we really started calling out health equity, saying it's not enough for smoking to improve across the whole city. Who is smoking the most? Okay, in youth, it's LGBTQ youth. How do we then measure success? It's not just does smoking go down everywhere, but does smoking go down among LGBTQ youth? Same thing for infant mortality. Let's focus on, African Americans in these neighborhoods where we're seeing rates. With our next plan, the reason it's called Healthy Chicago 2025 plan is it takes us from 2020 to 2025. We added to health equity this idea of really racial inequities. And specifically, we wanted to focus this around the fact in Chicago that prior to COVID, our life expectancy in Chicago was dropping for the first time, for as long as we've been measuring this. However, among white Chicagoans, it was continuing to rise just a little bit, where it was falling among all of our other race and ethnic groups. And specifically, white Chicagoans living on average 8.8 years longer than Black Chicagoans and the Black Chicagoans. Preventable, unacceptable, something we can work on. So we decided to take these racial inequities in the life expectancy gap and focus on what are the main drivers of that. The biggest driver of that was chronic diseases. So the same things we've been talking about for COVID risk. We see Black Chicagoans with higher rates of diabetes and more issues related to lung disease, heart disease, and then dying from these more. We've now seen on top of that how that has played out within COVID. And so with Healthy Chicago 2025, it is about what are people dying from, but more, what are the root causes? What are the structural inequities that have put these things in place? And so we are focused on systems of care, like you heard me talk about with mental health. Be a system where we're pulling together all of the different ways that people can get health care, make it easy for them and systematic. We're focusing on healthy neighborhoods. What does it actually mean to have a space where I have access to safe spaces to exercise, to good and healthy food, to a community where I can feel safe? All of these things, building healthy communities, ultimately builds health and works on the life expectancy gap. And then working on building community capacity and youth leadership. We feel strongly that data-driven solutions and community-driven solutions are where it's at. And then really talking very honestly about creating anti-racist systems. What does that mean? What does that look like? We want to call it out, and we want to be specific about what that looks like internally, externally, and talk about this inequity in Chicago. It's not going to be just the health department. It's all of Chicago really getting on board with Healthy Chicago 2025. So come back September 17th at 2:30.
Great.
Much more to say.
All right, thank you. Okay. Commissioner Arfa, there are also some changes to communication access for city services and communications that help the city address equity. Can you tell us about some of these changes?
So first, we have a Smart 911 program, which is a voluntary registry where you can put in information about yourself. For example, if you have a disability, a really communication access need, and then if you have to call 911, the emergency responder can pull up your information from that address, and they can anticipate if there are any disability access need. So you could go to smart911.com to sign up. Again, it's a voluntary registry. Second, another area that we're focusing on is communication access, especially with so much information being released, for example, about COVID-19 and about other news that's coming out. We want to make sure that everyone in Chicago has access to that information, including people who need communication access. So for tonight, I'd like to point out that at your screen, you will see a sign language interpreter at your screen, and then you will also see open captions in English, and then we also have open captions in Spanish too, and this is the result of a partnership between MOPD, OBM, our community engagement team, and our digital team. And that's how we can make these changes, but we all work together to create these changes to increase that access to information.
Yes, and we thank you for all your help today and for this week, because I know we were working closely with you to make sure we brought access to everybody. And to plug again, it's smart911.com. I've signed up myself, so I recommend everyone. Okay, great. So I recommend everyone in our city to go log on and to make sure you put your information to help our first responders. When we think about equity and inclusion, a key factor is also workforce opportunities. So Brandie, can you tell us a little bit about DFSS's workforce programming?
Definitely, thank you. In 2012, there was a partnership between the City of Chicago and Cook County to create the Chicago Cook Partnership. And so what the Chicago Cook Workforce Partnership does is it is the lead agencies for providing demand-driven jobs in Chicago. Typically, individuals who may be mid-career, maybe they lost their job, and to get back to work, they just need some retooling on their resume and some basic job training skills because they really have a good understanding. And so they're able to work with those individuals. The dollars that remained from that program came to DFSS, and so we really work with a pot of money that supports people who are high need individuals. And so those are individuals who are either homeless, they are justice involved, or they speak English as a second language. And so they have multiple barriers that prevent them from readily obtaining employment. And so we do that through 3 programs. Our first one is Transitional Jobs for people who have little to no skills at all. Maybe they've never held a job before, and so they really need the basics to get support. And so this is a subsidized wage program that supports individuals and employers with getting them back into the workplace. Our second program is industry specific, and it really focuses on individuals who have a specific career path in mind. Maybe they are interested in becoming a truck driver and they need a CDL license, and so they need that training, or culinary profession, or cosmetology, or even the trades. And so what the programs under this one model will do is support people to getting back to work and getting that certification. The last program we support in our workforce division is employment placement and preparation, and it's really for individuals who have skills, who are ready to work, they're just having trouble connecting to those jobs. And so we work with our nonprofit delegate agencies to support them to obtain and retain employment for 180 days or more. When you think about equity and inclusion, the leaders of the nonprofits that we fund to provide workforce, 60% or more of them are either Black or brown leaders and or women. And this is really important to us because it's important that the people who are serving our clients look like those clients, and so that they're able to relate to them and provide them with the type of services. When you think about where workforce programs are in the city, they are spread across Chicago, but they're highly concentrated in the south and west sides of Chicago where there's a need. As we look forward to rounding out 2020, we're using our CARES dollars to support additional workforce opportunities for people who have been displaced from the workforce due to COVID. And so we really want to make sure that we're putting our dollars to work and we're helping people obtain jobs.
And with the impact of COVID on unemployment that we've seen, like that work around your workforce development program is more important than ever. So
Definitely.
thank you. Okay, next question. CDPH has also been leveraging contact tracing as an opportunity for workforce investment. Allison, can you tell us a bit more about that?
Yeah, absolutely. This is another thing that's actually pretty unique to the way we are approaching this in Chicago. First, just let me level set quickly because sometimes people get a little bit confused. Every single person diagnosed with COVID in the city of Chicago, no matter where they live, gets a case investigation and then follow-up contact tracing. And that is done, primarily by the Chicago Department of Public Health. We pulled other folks in. But what we are in the process of doing right now is moving some of that contact tracing work out into communities, and not just into communities, but specifically into the community areas in Chicago that have high economic hardship. Because this was a big investment. These are, again, federal CARES dollars that came to us through the CDC, and we really wanted to say, if we're going to make a big investment in contact tracing, many other states and cities just hired a call bank, or they worked with a university. There's a lot of ready to turn on contact tracing programs out there at this point. But that is not what we wanted to do. And so we released a $56 million request for proposal, which Chicago Cook Workforce Partnership is going to be the lead on. And they right now are reviewing applications, and we'll be announcing just in the next week or two likely 30 community-based organizations in these areas of greatest need, where we wanted to make sure economic investment was going. And then those community-based organizations in turn will hire, and they'll be hiring from those community areas, from those neighborhoods. So this is West and South Side predominantly. You can go to chicago.gov/coronavirus if you want to learn more about the details of the neighborhoods, or you have questions about contact tracing jobs, et cetera.
Okay.
But the idea is that this isn't just a job, because remember, contact tracing is not going to be something that is a long-term, many years job. And so recognizing that people were probably only going to have this job for maybe 18 months, we wanted to also think about and are investing with these same, CBO, same community-based organizations, et cetera, thinking about resource coordination hubs and doing that very well, and really making job opportunities available for people who may have had barriers to employment, people who have been justice involved, people who we have not put any particular education requirement. You don't have to have done special contact tracing. And in addition to getting on-the-job training for doing contact tracing, we're working with city colleges to make sure that folks who are contact tracers will do an earn as you learn. So there will be opportunities to take coursework in things like potentially becoming a community-based health worker after this, or things like how to draw blood, thinking about building up more skills. Because my dearest hope is that these investments we are making, $56 million in communities where it is most needed, this sort of workforce, I want to be able to live beyond COVID. I want these organizations, these folks, to get really excited about doing this kind of public health work and take this contact tracing job, get additional skills, and then use it in their communities to do all the other things that we want to do as part of Healthy Chicago 2025. So time will tell what that looks like, but we really feel strongly about thinking about not just solving the immediate problem of contact tracing, but investing in workforce and investing in communities where it's most needed.
And so do you have a time frame of when we think some of these jobs will come online, or just to give folks an idea of when to look for them?
Yes. So I expect, and again, for folks who are interested, chicago.gov/coronavirus, right up at the top, there's a big banner that will take you to all things about contact tracing. Really in the next few weeks, I would say. We are obviously quick. We're wanting to get this going quickly, and we are already making some changes in terms of some of our staffing at CDPH as we expect more of these community-based resources to come on. So this is something that will be really opportunities will be available for contact tracing jobs. Again, priority is going to go to people who live in the communities with high economic hardship, and we will be excited to see what happens with this.
A definite investment in the future.
A definite investment in the future. And there is a place that people can sign up if they want to hear about when there are jobs available. You can put your information information. And it's not the formal application, but we'll make sure that you're on the list.
Great. Okay, and we have an additional question from Crystal Ann on Facebook. How do people obtain these workforce development opportunity services?
And so that's a good question. Individuals can call 311 or reach out to us through our website, and we can connect them to our workforce opportunities.
Okay, next question. How has the city addressed the needs of persons living with HIV AIDS during the pandemic?
Oh, sure. I like this question. So last year, our HIV program had actually done a lot of work with many partners to think about how can we be more comprehensive, where we are thinking about the needs of people who are living with HIV or vulnerable to HIV in Chicago. So we had done a whole thinking about how do we make it so that somebody doesn't need, if they have HIV or are vulnerable, doesn't have to call here for housing needs and here for food needs and here to make sure they're getting the drugs they need and here for their health care. And we created this HIV Resource Coordination Hub, really new, but a model for what we are now doing for COVID. So I think this work that we did around HIV and setting some of that framework has set us up well. So we've been able to use, we've gotten some of those additional dollars are specifically for HIV, and so we've been able to invest further in that HIV Resource Coordination Hub, but also we've been able to provide emergency financial assistance. So for people who have been living with HIV and vulnerable to it, we've had more than 750 requests we've been able to fill. And so that's everything, people who had food and basic needs or utilities, internet, right? This has been a major need right now. Medical expenses, even some rent and mortgage assistance. Really important that folks who are living with or vulnerable to HIV can stay on medications that helps keep their HIV, undetectable so they're not spreading it, or people who are vulnerable to it can take pre-exposure prophylaxis or PrEP, which again helps keep this, helps make people not spread HIV. And so we also invested in this hotel to home program that I was telling you about, thinking about telehealth, right? Making sure that folks can keep getting their telehealth. So those were some investments, making sure there were not interruptions to drugs during this time, that everybody was able to keep getting those. And then just additional things around housing supports. Again, the last thing that we want to see is us lose our attention in places where we have some strong programming. COVID is not the time to stop doing all of the other things.
Agreed. And
so we've kept up a lot of the strong work and partnerships that we have in HIV, and in fact have been able to build them.
Okay, question from Access Living. How will MOPD address the needs of people with disabilities during the ongoing pandemic, particularly those without access to digital devices, including in Chicago nursing homes?
Is first, and you could use the city's app 311, and you could call with any questions. And you could also access the app too, so you don't have to make a phone call to. So there's different options. So some of these, so during this ongoing pandemic, some of the sticks and MOPD started first. I'm very proud to say that our team has continued to work through this pandemic, whether it's teleworking from home or coming to our physical office. And our physical offices are open, and we take precautions to keep everybody safe, working with our city department to issue appropriate social distancing. And then during this ongoing pandemic, we've also worked to make sure that the information is accessible for people who may need communication access, including, for example, adding open captioning to really information going out. And then we've also worked to help get PPE to people in a building who are people with disabilities. We've also provided wheelchairs to our shelter so that anyone who needs physical access may need a shelter. We work to make sure that they were able to get wheelchairs. And then we conducted accessibility site reviews for our shelters and other buildings that have been used during this pandemic. And we continue to share information from CDPH to people with disabilities. And then we've coordinated meal delivery service, and so the people continue to get access to 80 meals. And we're also we've also put in the process of adapting our services so that they can be accessed virtually, so you don't need to come into our office, and that you can stay at home. They continue to shelter in place at home, and still be able to get the full range of all of our services here. And I'm pretty successfully for that question.
Thank you. Like most businesses, nonprofit agencies has also been hard hit by the pandemic. Brandie, can you tell us a little bit about how DFSS is supporting them?
Sure, thank you. So beginning in March, when the shelter-in-place order took place from March to June, DFSS continued to pay the salaries and wages for our nonprofits. And so even if agencies didn't open and personnel didn't come to work, we allowed them to still pay those agencies, and we paid our delegates to do that. And that was really through support that we had from our state and federal funders in order to do that. The second thing we did is we held bi-weekly webinars with our delegate agencies, and so all 7 of our program divisions had these bi-weekly webinars, and it was really important because we wanted to stay in touch with our delegates, make sure we were providing them with up-to-date information from the CDC and CDPH, and also be able just to communicate with them because they weren't in their offices and we necessarily weren't all in ours, and so we wanted to make sure that if they needed assistance, we were there to help them. The third thing we did is that we allowed our delegate agencies to make revisions to their budgets. And so in some instances, people had costs for transportation. And so since people weren't going to be using those transportation dollars, we allowed them to repurpose those dollars and use them for PPE support and other operational supplies. Some of our delegates used that because they were transitioning themselves from being an in-person service to a virtual service. And so they used those funds to pay for services like Zoom, WebEx, and Uber Conference. The next thing we did is we worked in collaboration with CPS and the mayor's office. We launched e-learning tools for our early learning parents. And so for youth 0 to 5 years old, this was especially important for parents who were isolated or teachers. And so they wanted to continue those early learning, and we provided resources for them. And lastly, for our delegate agency partners, for some of them who were not able to access PPE and other supplies based on donations that we received from the city, we supported them with those resources.
Okay, question from Matthew Surmat. How can we better ensure that human services are being distributed across the city in a more equitable fashion? How can we better provide human services in low-income areas? I'm gonna send that first to Allison, if you want to start.
Yeah, I mean, this is absolutely at the core of everything that we are trying to do at the health department, have been for some years. I think it comes down, first of all, is about looking at data, and we don't sort of go with stale data. We really, depending on what the issue is, we have surveys that are done professionally that help us understand how, at a community area level, people are experiencing life in Chicago, and what their concerns are, what their health issues are. We pair that then with information that we have about people's health status, their hospitalizations, if they have histories of some of the diseases that we work with, et cetera. And we importantly pair that with all of this root cause work. So what's happening related to employment and education and housing stock and neighborhood safety, and really think about where we make investments. You know, we don't have unlimited dollars. Like although right now during COVID, we're feeling like, okay, this is more funding to be able to distribute, boy, does it go quickly. And so where I think about testing as an example, like I would like to put testing absolutely everywhere. Where I put testing, because it is $2 million a week, is specifically where we are most seeing the need for testing. And that is what we are absolutely committed to at the health department, and then taking that data and combining it with community input. Let us know how can we best work with you to make sure that we're putting our resources, and just that together as a city, we are addressing needs where they are greatest. I think when we do that, we do build a better Chicago for everybody. And so, you know, low income is just a piece of some of what we look at. But it's, yeah, I think it's something we're very committed to, and I know the other departments are as well.
Rachel, do you want to talk about that?
Yeah, so we are located, we provide a lot of resources in our services because every single one of our 77 neighborhoods should be able to access our services. And I also want to make sure that Black and brown people with disabilities know about our services and can access them too. We have 2 locations, right here at City Hall, at the west side of Chicago, right across from the Jesse Brown VA. So I want to make sure that we make that facility as accessible and open to our services. And I pay specific attention to the south and west side of Chicago, making sure that we build partnerships and provide services and really focus on that area to ensure that every single neighborhood has access to disability services.
So for DFSS, our programs are located all across the city. We fund over 350 nonprofit agencies. So if you were to throw our sites up across a map, you would see that we're in every community area across the city. However, we're highly concentrated on the south and west sides of Chicago because that's where there's a high need for vulnerable populations that we support. So for example, if you look in Lincoln Park, you will see that we have very few programs there because there are already resources. As we go to market for RFPs and we look at where we're going to fund services in communities, we're looking to see how saturated an area is. And so if we realize that an area is saturated, we're not going to oversaturate and dump more resources. If we feel that they have enough of a particular program, we're going to look to see where there are gaps in other community areas because we want to fill gaps in so that people are getting support across the city.
Thank you. Okay, we have time for 3 more questions. We have a question from Madeline Bear. The network advocating against domestic violence is campaigning to have $35 million of police funding to be moved to support domestic violence and sexual violence services and or prevention work. What is the city's response to this campaign?
So at DFSS, we are very committed to optimizing and effectively using the dollars we currently have. We want to make sure that the dollars we receive, not only for domestic violence programs, but for all programs that we fund at DFSS, that we're using them most effectively. And so if additional dollars become available in the 2021 budget, we will work with Deputy Mayor Lee in the Office of Public Safety, and we will take it from there.
Okay. Next question. DFSS manages One Summer Chicago each year, but obviously this looked different because of COVID. Brandie, can you tell us about One Summer Chicago and how DFSS adapted this for the pandemic?
Definitely. So COVID-19 impacted us all, and we wanted to make sure that with the impact that it had on us, that we helped our youth get back to some form of normalcy. And so it was really important for us to strive to provide them with resources, mentorship, and economic opportunity. And so we launched virtually this summer our Summer Jobs program, which everyone calls One Summer Chicago, and we were able to hire 20,000 youth across the city. Wow. It's really exciting. It was virtual for the first 4 weeks, and for the last 2 weeks, youth had the option to come in and have in-person meetings. This was also the first summer that we raised the hourly rate for youth to $14 an hour. So that was a really big win for the program and the youth to bridge the digital divide. We were able to partner with Compudent, which is a national provider of refurbished devices for youth. And so through generous donations of funders, we were able to make sure that our youth had devices for the Summer Jobs program. At the end of the summer, youth who completed the program, they were able to keep the devices. In a direct response to COVID-19, we also created directly a virtual program, which is our Summer Youth Corps, and that was for 2,000 youth that were able to do online cohorts and learn civic engagement and leadership development, and they worked to solve problems that directly impacted their own communities. Leveraging some of the CARES funding that we received from our Workforce Services Division, they're going to be partnering this fall with Youth Services to continue the Youth Corps through December. And so we'll be able to hire and leverage additional dollars to support youth through the end of the year for the program.
Can Can I just add quickly to that the opportunity to have some of the youth social distancing ambassadors out this summer, through parks, et cetera, really having young folks in that 14 to 24-year-old age group out, giving out masks, really encouraging people to social distance. We like this idea of having younger people help spread the word to younger people, which is where we're seeing still a lot of spread of COVID, and really, again, offering kind of youth job opportunities that can also translate into us better controlling COVID here in Chicago. So thanks for that.
Thank you.
We were lucky to have 5 students with disabilities through summer Chicago in our department. And I think it was one of my favorite days getting to meet with them. And they focused on a project on how to get information about the citizens out. And they had some very impressive drawings about how to promote the citizens.
Okay, last question. We've talked a lot about all of the great work, I think, that everyone is doing, and so this is actually a really good question. How do your departments measure outcomes? So we've talked a lot about investments across the 3 days, but how do we measure those outcomes? Do we use data to guide our work, and how do we hold delegates accountable? So I'm going to start with Allison, and we'll work our way through.
Sure. So we are very committed to measuring outcomes. I have, even during non-COVID times, I have a whole epidemiology team, which is my data team, basically, my data science team. And we are thinking not just about passively measuring what's happening with health in Chicago, but very specifically where we make investments, where we work with delegate agencies, what sort of outcomes are we seeing with that? We also, similar to DFSS, we have a lot, we are responsible for making sure that federal funding or state funding is used appropriately. And so we're often working with our delegate agencies to make sure to follow up that the things that we are funding them to do, in fact, are happening, and then that we are then seeing good outcomes from them. So if I just take HIV as a very specific example, we said it's not just enough maybe to say, are we housing people with HIV? That's sort of a check, we've done it. Instead, let's think about when we're housing people with HIV and connecting folks to care and doing this, are we able to actually see an improvement in what's called somebody's viral load? Or is HIV in better control in Chicago? Do we see impacts of these investments that we make in terms of the health outcomes? So I really believe firmly in setting some goals that are achievable, but also a little bit of a reach, that really push us. And again, with an equity focus. I'm more interested in making sure that we make progress in some of the areas where it is historically harder to make progress. And if people are interested, I will send you, first of all, you already know the COVID website, but the ChicagoHealthAtlas.org is where we collect data across the city, make it available by community area. You can really use that to explore, and then you can find out more about what the health department is doing in partnership with others. ChicagoHealthAtlas.org.
Rachel, do you have any last words about measuring outcomes and how you're achieving some of the goals that you talked about at the beginning?
Yeah, so that's something that I put looking at that, and coming as a new commissioner, I really put looking at what has happened in the past and where these opportunities to do more. So out of that data, and it's really important, but also having an open communication with our delegate agency, because we do rely on our delegate agency to help carry out the goals and services of our departments. So we are really looking at that very seriously. So for me, being able to look at that and past data and figure out a path forward is so key.
So at DFSS, since 2016, we've worked very hard to be a data-driven department and looking at not just collecting outputs of how many people are you serving to really what is the impact of the dollars and the services that you're putting into communities. And so we do a couple things. One, data is known throughout the department. We are all comfortable with having those data discussions. And so within our program divisions, people are not waiting till the end of the year or half a year to discuss, how well are we doing. They're sitting down with their teams and their deputies regularly talking about data and outcomes. The second thing we're doing is is we're making sure that we're involving our delegate agencies in those conversations. And so through cohort meetings, we sit down and we bring in all of our delegates into teams. And so it'll be a mix. It'll be high performers and low performers, and everyone's talking about how did you move the needle? What did you do that made a difference? And it's really not to penalize people, but to say, how do we raise the floor so that we can make sure everyone is getting sufficient services? The last thing that we do is we really use our databases, right? And so we collect a lot of data at DFSS because we have many different funders. And so we are using that data to leverage it and have meaningful conversations. And so every time our RFPs, and so we go to market through the request for proposal process. And so each time an RFP sunsets, we use that as another opportunity to think about what is it that we want to push the needle a little bit further. We really encourage our teams to not just take the easy goal that you know you're going to hit easily, right? Really create stretched goals because we know those are going to have the most impact.
All right, thank you everyone. We are out of time. This has been a great conversation. I hope everyone learned tonight all of the great programs that I know all of you are working on. We will be back here tomorrow hosting our infrastructure departments, which includes the Departments of Streets and Sanitation, our Departments of Transportation, as well as the Water Management Department. So we will be back here at 6 p.m. All the information around our survey and other ways to participate in our outreach process are again at chicago.gov/2021 budget. And thank you to everyone for joining us tonight. We hope to see everyone tomorrow. Good night.